Shoulder pain is extremely common, and while surgery is most often a last resort, we've learned you have options which prove to be helpful for a man who's been living with arthritis in his shoulder for decades. We take you inside the operating room for his story in tonight's Health Watch.
So bring your arms up above you as high as you can go. That's awesome range of motion already.
3 months ago, Robert Rodriguez could barely lift his right arm. He had immense pain in his shoulder and has so for 30 years, which is why he finally opted for surgery. We met Robert in pre-op at Northern Nevada Medical Center.
I'm getting a total right shoulder replacement here, and I have severe degenerative arthritis, which has worsened over time.
Great Basin orthopedics surgeon Dr. Michael Lillyquist planned to perform a newer technique called a resurfacing total shoulder.
Instead of taking off the whole entire ball of the socket, you just resurface it or put a cap on top of it. And the purpose for that is to preserve bone, and that's usually done in the younger population.
And it means a little downtime. You can start physical therapy right away, as opposed to traditional and reverse total shoulder replacements, where you replace the ball and socket with an implant that stems down your arm. Now, depending on the stability in your shoulder, sometimes the ball and socket switch sides. But since Robert is only 60, Dr. Lillyquist opted for resurfacing his ball joint, so he'd have enough bone left for a possible revision surgery down the road. But in the operating room, plans changed, and he pulled me around to see why. When Dr. Lillyquist opened Robert up, he found 3 decades worth of bone spurs.
So that's all indicative of arthritis, everything that's going on right there.
30 years of it, huh?
Yeah.
The bone spurs created so much extra room, the ball was moving around too much in the socket. So Dr. Lillyquist had to use an implant after all and put Robert in a sling for 6 weeks to allow scar tissue to help stabilize it. But today, Robert is feeling great. He's sleeping better and way more functional.
I'm starting to get a lot of range of motion back, and a lot of the original pain basically has gone.
And even though surgery plans changed mid-operation,
We always go in prepared and ready to take care of any scenario that may arise like that.
Plan B, C, or D.
Yep, exactly.
Dr. Lillyquist likes what he sees.
The position of your joint looks fantastic right now.
Okay.
So
He's a new man, and to learn more about all these options, we'll have Dr. Lillyquist on our Ask the Doctor segment, not this coming Monday, but the following. So Monday, August 14th, you can call in then. For a closer look, go to KTVN.com and click on the Health Watch icon.